Scientists around the world are meeting in Geneva to discuss ways to combat the new coronavirus. The chief of the World Health Organization said there is still a chance of containing it if enough resources are devoted to the fight.
A virus can have more powerful consequences than any terrorist action. And that's true. And if the world doesn't want to wake up and consider this enemy virus as public enemy number one, I don't think we will learn from our lessons.
One step forward, the virus has been officially named as COVID-19. It doesn't stigmatize people or places.
We had to find a name that did not refer to a geographical location, an animal, an individual or group of people, and which is also pronounceable and related to the disease.
Meanwhile, the businessman at the centre of the UK outbreak has thanked the NHS for his treatment at London's St Thomas's Hospital. Steve Walsh sparked a cluster of infections in the UK, France and Mallorca after picking up the virus in Singapore. Walsh did everything correctly, informing UK medics as soon as he knew he'd been in contact with a confirmed case. He'd had no symptoms but self-isolated at home as instructed, and when he was confirmed, he was sent to a hospital isolation unit. His family was also asked to isolate themselves. With China on the front line of the COVID-19 outbreak, expats around the world are showing solidarity, donating money and goods to their motherland. Medical supplies and protection suits are being sent by overseas Chinese from as far afield as Spain and Tanzania. Evelyn Laverick, Euronews.
Our reporter Vincent McAviney is following the story in London, and we can go live to speak to him there now. Morning to you, Vinny. The message from the UK authorities certainly seems to be that everything's under control, they're handling it. Do the public have confidence in that message?
Good morning, Rosie. Well, the UK Health Secretary Matt Hancock has actually said that things will get worse before they get better, and he's talked about the NHS, the British Public Health Service, building more quarantine sites onto hospitals and taking further precautions. But the Prime Minister Boris Johnson has tried to reassure people, saying that everyone should be confident and calm about the response. Now, the government has, since the start of this, taken it quite seriously with COBRA meetings, which is the top level of government emergency meeting. And so far, the public are staying calm. They're asking for more information. I have seen over the past couple of days more people, though, walking around with face masks in London. And I think it's unfortunate that the businessman mentioned in that report, Steve Walsh, was given that tag by the tabloid press here as a super spreader, because as he said in his statement, he did everything right. He told the NHS when he had the symptoms, and yes, a number of people were infected, but that is what will happen with this virus. So the public at the moment, some people in Brighton have been a bit critical, saying that the city hasn't provided enough information. We saw a GP practice closed down there, some schools as well, children being told that they don't need to go if they're showing symptoms. So people are asking for more information, but at the moment the public here is staying relatively calm.
Despite the warning from the WHO, European authorities still say the threat is very low. Can you give us a bit of a snapshot about the situation across the continent?
Well, yeah, many of the continent's airlines have now suspended flights to mainland China as a way of trying to stop the spread of this virus. There have been, of course, big public health messages going out. But so far, we've got 33 cases across the continent, the biggest being in Germany. There are 14 cases there, 11 cases in France. But the European Union, its crisis centre in Brussels, has been trying to coordinate the response of European countries, making sure that they're all putting out the same public health message. There is going to be a meeting of the health secretaries of the 27 EU member states, we believe, on Thursday. And the EU is also looking at sending supplies, things like gloves, face masks, hazmat suits, to China in order to help them, because there are shortages in the country. Germany and France, we believe, have already done this. So there is a coordinated response, it seems, across the continent.
Vincent McAviney, thank you very much for that update live in London outside St Thomas Hospital.